Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Thursday, February 12th, and this is HITshow. Today's stories point to a clear trend. Health systems are investing heavily in automation at both the front door and the back office, while financial pressure continues to reshape workforce strategy across providers and payers alike. We'll cover a new AI-driven patient access initiative involving Mayo Clinic, how CommonSpirit is using AI to improve financial performance, workforce reductions affecting both a major health system and a national payer, and later in today's Bright Spot, a coalition of hospitals and safety leaders launching a new standard for patient-facing AI. Let's get started. Patient access continues to be one of the biggest operational challenges for health systems, and Mayo Clinic is taking a new step to address it. Nate Collier has the details.
Mayo Clinic is collaborating with digital health company Ubie to develop an AI-powered platform designed to improve patient triage, scheduling, and navigation. The goal is to help patients find the right level of care faster, whether that's primary care, urgent care, virtual care, or specialty services, while reducing pressure on call centers and intake staff. Executives say the digital front door has become one of the most important operational battlegrounds in healthcare. Many systems still rely on fragmented scheduling tools, manual triage, and long call wait times, all of which contribute to leakage, delayed care, and staff burnout. AI tools like this are increasingly being used to guide patients through symptoms, recommend appropriate care settings, and connect directly to scheduling systems. For large systems, improving access isn't just about patient satisfaction, it directly affects throughput, revenue capture, and capacity management.
Nate, are systems seeing measurable returns from access improvements like this?
They are. Access improvements often produce some of the fastest ROI in healthcare because they increase utilization of existing capacity and reduce administrative workload at the same time.
And before we move on, here's the executive takeaway. For hospital leaders, access and patient navigation are emerging as some of the fastest areas to see measurable returns from AI because they directly affect throughput, staffing, efficiency, and revenue capture. Thanks, Nate. While some hospitals are automating the front door, others are focusing on the back office, and the financial impact could be significant. Teresa Vaughn is following that story.
CommonSpirit Health is deploying AI tools designed to improve financial operations by identifying savings opportunities, analyzing cost patterns, and detecting areas where revenue may be slipping through the cracks. Large health systems operate incredibly complex financial environments, with thousands of supply contracts, reimbursement streams, and operational cost centers. Traditional reporting often surfaces problems weeks or months after they occur. AI platforms are beginning to change that by analyzing financial and operational data in near real time, allowing leaders to detect trends earlier and intervene faster. Industry analysts say this shift reflects a broader change in how hospital CFOs view technology investments. Rather than focusing primarily on clinical innovation, many organizations are prioritizing tools that directly affect margin, productivity, and operational efficiency.
Teresa, are we seeing this kind of investment across the industry, or mainly in large systems?
It's starting with larger systems because they have the scale and data infrastructure, but mid-size organizations are watching closely, especially as reimbursement pressure continues.
And here's the executive takeaway from this one. AI in healthcare is no longer just about clinical decision support. Increasingly, it's being deployed to recover margin, improve operational visibility, and help finance teams act faster on emerging cost trends. Thanks, Teresa. Still ahead, workforce changes affecting both providers and payers, and in today's Bright Spot, a new industry effort to make patient-facing AI safer and more reliable. So we'll be right back.
Every morning, hospital CEOs, CFOs, CIOs, and innovation leaders tune in to HITshow Daily for the healthcare business news they need. Your next customer is already listening. Visit HIT.show to explore sponsorship options.
Welcome back. You're listening to Hit Show. Financial realities are also continuing to affect workforce decisions across healthcare. Teresa, you've been tracking developments on both the provider and payer sides.
That's right. Memorial Hermann Health System has begun offering voluntary buyouts to some employees as part of a broader strategy to manage costs and improve operational efficiency. Health systems nationwide continue to face rising labor costs, slower reimbursement growth, and ongoing inflation in supplies and infrastructure. Many are responding by restructuring administrative roles, consolidating departments, and investing in automation. At the same time, payer Cigna has announced plans to reduce its workforce by roughly 2,000 employees globally. The company says the move is part of efforts to streamline operations and remain competitive in a rapidly changing healthcare environment. Taken together, these moves reflect a broader shift. Organizations across healthcare are redesigning workflows, not just trimming budgets. Leaders are looking closely at where automation, outsourcing, or process redesign can replace manual work.
Teresa, do executives view these changes as temporary cost control or something more permanent?
Most leaders see this as structural. The operating model of healthcare organizations is changing, and workforce design is changing with it.
Important context. Thanks, Teresa. And now, in today's bright spot, a development aimed at making healthcare AI safer and more trustworthy as adoption accelerates. Nate Collier has that story.
A coalition of healthcare leaders has launched the AI Care Standard, a new framework designed to evaluate the safety of artificial intelligence tools that communicate directly with patients. The initiative was announced by Vital's CEO Aaron Patzer and includes contributors affiliated with organizations such as MedStar Health, HCA Healthcare, Stanford, Highmark, Indiana University Health, Hackensack Meridian Health, Children's Hospital Los Angeles, and Texas Children's Hospital, along with patient safety advocates and nursing leadership groups. The framework provides scoring tools and principles that health systems and vendors can use to evaluate whether patient-facing AI tools are safe, reliable, and appropriate for clinical environments. Organizers say the goal is to create a practical middle ground. On one side, technology companies are moving quickly to deploy AI capabilities. On the other, many health systems remain cautious, sometimes limiting tools in ways that reduce usefulness. The coalition says governance, transparency, and measurable safety standards will be essential as patient-facing AI becomes more common in triage, navigation, and remote care.
Nate, this feels like a shift from building AI to governing it.
Exactly. Many executives now say their biggest concern isn't whether AI works, it's whether it's safe, auditable, and defensible. Efforts like this are aimed at answering those questions before widespread deployment.
An important development to watch in the months ahead. Thanks, Nate. That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare.